Sir, now you told sometimes this constipation leads to cancer.
No, constipation will not lead to cancer, but
Okay.
constipation with bleeding can sometimes be a presentation of cancer.
Cancer.
Yes,
Okay. So,
constipation does not lead to cancer,
okay,
but
okay.
cancer can lead to constipation.
Oh, okay. So, when the patients need to approach the proper consultants.
Yeah, that's what I said. Any
Hmm.
patient who is having symptoms of bleeding or pain along with constipation
Okay.
and constipation which is not going away.
There is any time period, sir? 2 days, 3 days,
No, no,
four
you
days.
can have constipation for you ate something wrong, you had a
Hmm.
party on the weekend, you ate some a lot of junk food, you had
Hmm.
drinks and other things. So that all will lead to constipation. So constipation for 2 days, 3 days, week, 2 weeks, you can just ignore. But
Okay.
sometime when it persists beyond a month,
Oh,
or it
one.
yeah, like patient will not pass, he will not complain that I'm not passing stools for 1 month,
Okay.
but
Okay.
say he is passing stools every 2 days, second day, third day,
Third
or
days.
stools are hard and these symptoms persist for around a month or so.
Okay.
Okay, that's the time when they should approach us.
So, what are the treatment options for piles?
Okay. So, piles is something that we grade. So, there are gradings of piles which we as physicians, healthcare providers do. So, ranging from grade 1 to grade 4. So, the treatment depends on the grade of the patient. So, whichever grade it is, so treatment will vary. So, for early grades like grade 1 and grade 2, we always start with lifestyle modifications in the
Okay.
form of fiber diet, a lot of water, and bowel habits. You should not sit for a prolonged period on the in the washroom. Then there are certain medications that we can try for grade 1 and grade 2 piles. So, just a tablet. But if the patient persists with symptoms despite the lifestyle modifications, despite the medication, the pills that we give, then there are certain things that are called as office procedures. So
Okay.
we do these procedures under local anesthesia or sometimes even without anesthesia in the OPD itself. So there are some called rubber band ligation, infrared coagulation, radio frequency ablation, and similar things, injection of sclerosants. So many things are there that we, once we see the patient, we will come to know which is the best treatment option for that particular patient. And then if it's not going away with even with the office procedures, then or the patient comes with grade 4 hemorrhoids already, which is protruding out, which is not going inside. So patient will complain of lump around the
Okay.
anus, bleeding with the stools, and that lump is not going away. It's persistently there. So that is what we call as grade 4 piles. So that always requires surgery.
Okay.
So patient needs a surgical intervention that time.
Okay.
So there are various surgeries that we can perform for such patients.
Okay.
Normal conventional surgery, stapler surgery, or there are some latest modalities that we can use.
So, just now you talked about radio frequency and Raffaello.
Yes.
What is this Raffaello, sir?
Yes, I'll be happy to introduce, in fact, a Raffaello procedure, which is the radio frequency treatment for treating hemorrhoids.
Okay.
It is for the first time
Oh,
in Hyderabad that we
nice.
have started this procedure at Apollo Hospital.
Okay.
So we have done few cases who are doing extremely well. So this
Oh,
procedure is something that can be done in the office,
okay.
and the patient can go home same day. And the best part is the next day the patient can resume his normal duties. So you
Oh,
don't need to take any leave. You can get it done on the weekend. Okay,
okay.
and on the coming Monday you will go and join your duties. So no need to take any leaves because
Okay.
it's painless procedure. So usual procedures for hemorrhoids, the conventional hemorrhoidectomy that we do, is one of the best procedures, but it is associated with pain.
Okay.
Patients complain of pain in the post-operative period for around a week, 2 weeks, 3 weeks.
Okay.
So, and patient needs to take a leave from his office. So we need to admit the patient for at least one night, and then around a week or 2 weeks they take rest at home. So they lose that 1 or 2 weeks from office, which is really
Okay.
difficult, I believe, in a corporate culture. So
Okay, yes, of
patients
course.
who have having young people especially who are having hemorrhoids, who are having piles, which needs treatment, so they can undergo this procedure. They can just walk into the hospital,
Okay.
get the procedure done, and in 3 to 4 hours they will go home.
Oh,
And next day they can resume their duties. So that is the beauty of this Raffaello procedure.
nice. And congratulations, sir. First time in Hyderabad
Yes,
in
it's
Apollo
yes,
Hospitals, Jubilee Hills.
yes.
Okay.